about us. Think about you.
Roel, D-Lam, what's up? All right, we're getting live here. Mary Lou, hello. Great to see you. I see Mama T's in here. Let's see. Thank you guys for hanging out over here on Instagram. We are live, I believe, everywhere. Looks like just YouTube at the moment, but hopefully that'll change here shortly. Foxy Moxie, hello. If you're on Facebook, let me know. It looks like we're not live yet on Facebook. I cannot figure that out. Okay. Danny, what's up? Great to see you guys. All right, Tom, thank you. Tom is on Facebook. So we are live on Facebook. Let me know, Tom. Let me know. Yeah, definitely let me know. Edna, what's going on? Great to see you as always. Thank you so much for my Halloween treats. I drank out of that coffee cup yesterday. Kendra, what's going on? Great to see you over here on Instagram. Thank you, guys. If y'all have questions for Doc, put them in the comments here. Who else is with me? Oh, thank you, Foxy Moxie. Thank you, Jerry. What's up, Jerry? From the UK, Leanne, what's going on? Great to see everybody. We're going to let a few more people come in, then we'll answer questions. Jamie, hello. Great to see you. Mama T, I see it. Thank you so much. That's a great question. MC, what's up? Taking live questions tonight. Jay, what's going on? Great to see you. I love the BPC question. I like that. All right, we're going to let a few more people come in here. If you're first timer, let me know. Lisa, how are you? Give me an update on how you are. How's your health? I've been praying for you. Thank you for being here tonight. Any first timers? Any first time visitors to the show? We're going to be here for an hour. We're going to answer all your health and wellness questions. Linda, I love you. Great to see you. Real quick before Doc gets in here, I want to put this up. Ashton Williams did a fantastic job on the Common Sense MD today, talking about the misconceptions around menopause. Ashton and Robin Riddle, as you know from Explain This, went to an integrative conference 2 weeks ago, talking mainly around female hormones. Ashton came back, did an episode with Doc on all the things that they were going over at the conference. So if you're wanting like an extremely up-to-date look at female hormones, that is the episode for you. Huge shout out to Ashton for doing that. For those who are local, you might recognize her face. She was on the news. She was a news anchor for years before becoming a nurse practitioner. So Ashton, thank you for doing that. She's out of our Kingsport and Johnson City offices. And then we're doing a new series with Bo McGregor talking about keeping it simple. And Bo is our guy for this. He talks about just kind of basic fundamental stuff. Sometimes all the things we talk about in integrative medicine, functional medicine can be overwhelming. We talk about nutrition in this episode. Huge shout out to Bo McGregor out of our North Knoxville location, talking about kind of foundational nutritional advice. As you can see there in the thumbnail, protein first. It's a little hint as to what he preaches. Thank you, Bo, for doing that. One step forward, I see you. Yeah, Tom, you like the KISS principle. Thank you, Lisa. Okay. We're praying for you, Lisa. Thank you. Guys, let's lift up Lisa tonight. It seems like she's on her way to recovery, but is still very sick. So we're praying for you. If you're with us live tonight, put Lisa in your prayers. All right. Thank you guys on Instagram. Thank you, Mama TSC. If you guys got questions, put them in the comments. I'll be looking over here. Great question, Foxy Moxie. And we're going to rock and roll real quick as soon as I can. I know one thing, we don't have a thumbnail for this yet, but for those who are local to any one of our offices, we are doing Black Friday specials the week of Thanksgiving. So our biggest specials of the year are happening Thanksgiving week, Black Friday week. So kind of stay tuned for those specials. Our flyers are already up in the offices if you've been to an office. What's going on, man?
Hey, man. How you doing?
I like the hoodie.
You do?
I dig that.
Yeah, we had that printed out a couple years ago.
Yeah. It's one of my favorite ones, actually.
Yeah. We work for patients, not
right.
insurance companies.
That's right.
Not corporations.
That's right. That's what we're doing tonight. We're working for you guys. If you guys have questions, we're answering all of them tonight. Wayne, I see you on YouTube. Thank you.
Do we hold these?
Yeah, we do. We do, because we're about to hit record. Oh, shoot. We need an SD card. Real quick, let me get it. We'll wait on the SD card to put in there. If you're watching this, team, we need an SD card up here for the podcaster. But until then,
would you like me to entertain before we do that?
Play some music.
Play some guitar.
Play some guitar. All right, let's see who else. Any first timers with us tonight? We're going to answer questions tonight. All right, thank you, Foxy Moxie. Thank you, Leanne, for that question. We're going to get to that here shortly. All right, let's get rocking and rolling. Let's see where to start here. Hold on 1 second. I would love. Can you shoot Jenny a text real quick on your phone?
I'll go.
Oh yeah. Thank you.
All
Thank
right.
you. We're gonna get
You
an SD
entertain.
card. I'll entertain. I just need an SD card for the Doc Miller. I see you. Great to see you. Thank you for being here. Just a little tech stuff tonight. What's our SD?
Is that out?
It's not in here.
Are you already on?
Yeah.
Say hi, everybody.
We're getting ready to record for the
Hey,
podcast.
Tom, it's on.
Oh shoot!
It's in there.
Why did it say no SD card? Press record.
Yeah. Say hi, everybody.
Hello. Just press record. Hello.
I don't know, but I gotta let it try.
There we go.
Oh no, it's not. No, it's no SD card. So,
That's okay. We'll audible.
okay, we'll audible.
We'll audible it.
Okay.
All right, Doc. Let's make it happen. We're gonna answer questions here. We're going. Can y'all hear us? Okay. Just want to make sure y'all can hear us. And we will keep moving here. Phelan, what's going on? Great to see you guys on Instagram. Thank you guys so much. All right, let's rock and roll.
So what does it mean we've got no SD card?
That means we have no use for the mics. We're not recording the audio
Yes,
for the
yeah,
podcast.
we're gonna get there.
We're gonna get there. We're gonna get there
Oh, okay.
eventually.
Just think positive.
Okay, so no mic.
And there's can y'all see Ike? You can't see Ike. Okay, this is a very timely question, everybody. Approaching the cold and flu season, what daily supplements are recommended? And if you start feeling off, what supplements should you increase? I love this question.
Okay, that is a good question. Because cold and flu season is going to be here. I didn't take a flu shot. Did you take a flu shot?
I didn't take a flu shot.
That's the last thing I want is a flu shot. It's not the way to stay healthy.
It's not the way to stay healthy.
No, taking a flu shot is not the way to stay healthy. I saw that on a billboard, CVS Pharmacy, on a huge billboard. The way to stay healthy, take your flu shot. And I said, no, that's not the way to stay healthy. The way to stay healthy is take care of your own immune system. So,
Maybe strong.
but in any event, great question. Cold weather's here. We're officially in standard time now, which I hate.
I know, it's so dark.
You know, I don't like it. Didn't get to play pickleball tonight. Took a walk.
I took a walk with you.
We had a great walk. So it's a great question. Yeah, I mean, of course, you always should take D and C and zinc. Those are the three biggies. And when you should always do that anyway. That's in the super multi. But when I start feeling off, I definitely I'll take the immune formula, which has more D, more C,
Yep.
a little bit more zinc. If you take too much zinc, you'll be nauseated, but it has enough. You do want to pop your zinc up a little bit to around 60 at least.
Is this
if you
right?
start feeling off. Yeah,
Okay.
that's it. Oh,
Okay.
good one. How'd you pull it up so quick?
Just technology. Technology is working for us right now. There we go.
Yeah,
Is that
so
are
I
those
start
the right
taking that.
amounts?
Yeah, and the quercetin and NAC, N-acetylcysteine, folate, B12. That's what I start taking if I feel off. And a lot of times I'll take it if a lot of things are going around too. I also am a believer in ivermectin. So
Yep.
if everybody else is getting sick, I start taking ivermectin. And also elderberry is a pretty good one if you want to do that. But some people will also, if I'm around a lot of it, I'll squirt Cofix up my nose, which is kind of like betadine, povidone, iodine. And definitely if I start getting a sore throat, then I will squirt it in my throat as well.
The Cofix.
Yeah, the Cofix. You should have some of that at your house. That should be part of your medical kit, especially if you're traveling, because that's how these viruses get in, is through your nasal passages. That's funny because I had a patient ask me today. He said, "Isn't it good to get a cold once or twice a year to stimulate your immune system to fight things off?"
That's a very interesting question.
Yeah.
What'd you say?
I had to kind of agree with him. I don't like to get a cold. Don't get too many colds at all. I used to get 1 or 2 sore throats a year, which led into a sinus infection almost every time.
Me too.
Not so much anymore. I guess it's because I take all these vitamins. So, I would never want to get a cold or anything, but there's a certain point in that because your body should be able to fight this off. And I think if you get it, then you up your vitamins like that and then just kind of get through it. So
the other thing I hear you tell me is 50,000 units a day of D.
Yeah.
Taking just really up in your D, especially if you start feeling a little off.
Yeah. And also you could take a vitamin C 1 gram every hour during the day when you feel bad.
Have you ever tried that?
I did when I had COVID a few years ago.
Did that help? I don't
I
remember
guess,
doing that.
again, when we had COVID, we bombarded it with everything, because we wanted to hit it off and not get bad.
This is kind of a follow-up to this question. Would ivermectin be advantageous as a preventative during the cold and flu season?
For sure.
If so, so you're saying it is, what are the dosages and would you need a prescription?
It depends on the weight, but for, say, a 70 kilogram person, which is average, I would take about 12 to 15 milligrams. Like you could take it daily or twice a week. I do it twice a week during the season. I also take it if I'm traveling. If you get sick, you start taking it every day. Double it and take it every day. Like double it, like meaning at least 30 milligrams daily for 5 days. But as a prophylaxis, take 12 to 15, even every other day or twice a week, I think is fine, along with the other stuff. Now, would you need a prescription? In Tennessee, you don't. At certain pharmacies, you can get it over the counter at pharmacies that have a backup doctor, and there's many of those around. Certainly, we have them in Knoxville and Kingsport, Johnson City, Bristol. Tennessee is really the only state in the union that you don't need a prescription for it. All the other ones you do.
Is there not necessarily for like this reason, but for cancer, can you still get a prescription for ivermectin? Is that true?
If a doctor writes it.
Okay. So it's not OTC if you're using it for that use.
Sure. Any reason to use it. So OTC in Tennessee.
Okay.
Yeah.
I'm going to put this up here. Thank you, Tom. If I can see that, there we go. 50,000 units, you start feeling better quick. I love this for my brother Jake. Ivermectin and beef liver has helped him get over colds this fall. Brookhaven.
Man, I forgot.
Come on, man. Come on. I knew it.
I was late.
I knew it, man. I looked at him like, where in the world is his hat?
Yeah. Well, I have my hoodie on. Usually don't wear a hat if I wear a hoodie.
Carter, I see you. Happy Tuesday to you. This is one of Carter's favorite shirts as well. The I Work for Patients shirt. That's one of my favorites also. Thank you, Kay. I see you, Kay. All right, we're gonna get to the live portion of the show. This is my favorite part. So thank you guys for hanging out and asking these questions. I already see so many great ones. I see you, Celeste. Thank you for being here as always. I'm going to start with Mama T over here on Instagram. So for the people here, if I'm over here, I'm looking at Instagram, but I'm moving back over here, back and forth. Mama T is asking, when doing initial lab work for female patients seeking hormone therapy, is an expanded thyroid panel part of the labs, or is it dependent on the provider? I love that question.
It's just dependent on the provider. You know, if you just come in and you want your female hormones checked, just get the female hormone panel. If you are around the perimenopausal age and you're wondering, am I on menopause or not? Where am I? Then you can get an FSH and LH. It'll tell us, along with your estradiol, progesterone, testosterone. But certainly if you suspect you have either an underactive or an overactive thyroid, or you feel tired and you're already on it, then you get a thyroid panel as well.
Okay.
So it's very important.
Mama T, let me know in the comments over here on Instagram if that's helping. I'm going to get to Chris Nora over here on Instagram as well. My GYN told me I don't need labs done for hormones because if I don't have a uterus, I only need estrogen, and that is all I need. I'm not seeing a question there, but I know you have a comment on that. What's your thoughts on that?
Yeah, it's totally BS, I think. You need progesterone, whether you have a uterus or not. It has 300 functions. Granted, when you don't have a uterus, you don't need the protection inside your uterus against overstimulation with estrogen, but you need it for all the other reasons. It calms you down, helps you sleep, protects you from breast cancer. I mean, it has a lot of functions. I mean, why would you put that out and all of a sudden you don't need it just because you don't have a uterus anymore?
Yeah.
So I disagree with it. You also need testosterone, and you need to see where you're at. You want to see where your labs are. You may be estrogen dominant still, even whether they took your ovaries or not, whether your adrenals are putting it out, whether you may be overweight and some of that fat is producing estrogen. So you certainly need it done, in my opinion. Certainly.
All right, let me know in the comments if that helps, guys. Thank you for those questions. We're taking questions on Instagram as well. Just put them in the comments, and I'll be over there periodically throughout the evening. I want to give a quick shout out. We got the PM Johnson City nurses represented tonight with Lauren.
Oh, hey, Lauren.
Lauren, thank you for being here tonight. After a wonderful day's work in the Johnson City Clinic, PMJC nurses are here, everyone. Thank you so much.
All right.
All right, let's get moving, guys, to the questions on YouTube and Facebook. I see in LinkedIn as well. Instagram, I'm looking at you. Let's see if I can see a question. Let's get to my brother Jay here. Since BPC 157 is for healing, would it reverse a heart ablation and cause issues again?
No. I can't imagine that. No, if you got a heart ablation, it's ablated. It's not going to grow back. Just if they did a good job. But I've never heard. That's a good question, but it's not going to regrow the electrical system of your heart for sure.
Okay. Jay, thank you for that question and getting us started off here tonight. One Step Forward is asking for a friend after having COVID. Is there anything you can do to get your taste back quicker? It's been several months. I know you've seen this before.
Saw it today.
Really?
Yeah.
What's your thoughts?
Couldn't eat chicken. When she eats out, it tastes terrible for the most part. It's no longer a pleasure eating. Taste at all.
You lose a lot of weight that way. Don't you? Just because you don't.
You can lose weight. Some people gain weight because they eat out of texture and they eat too many carbs.
Okay.
But yeah, zinc is one thing that you need to definitely have on board. The other thing that I like for this is nicotine patches, and I like low-dose naltrexone. And you can kind of retrain your sense of smell and taste by exposing yourself to different smells. Like, get lavender, get cinnamon, get different herbs, mints, and things like that, and purposely retrain your brain because your brain will remember what kind of what it smelled like. So if you put it there and sniff it and think about it, you can retrain your brain to have those olfactory nerves working again. It's not easy, but those are the main things I use for that.
Okay.
And a lot of times I'll put people on ivermectin. That seems to help as well.
And for One Step Forward's friend, there is hope though.
Of course, yeah.
Okay.
Eventually, it's going to come back, but to speed it up, because I've seen people go for 3 years like that.
God, man.
Yeah.
One Step Forward. Thank you for asking that question on behalf of your friend. I hope that helps.
And always look, if you really, I had a guy today who had an olfactory malignant tumor. And today I saw him, and he lost all taste and smell, and it was because of that tumor.
Really?
He went to Vanderbilt, had a 12-hour surgery, got a cure, but it was an olfactory tumor.
How long was he without taste and smell?
He still can't because he had a tumor taken out, but it was months and months. And then he started getting a lot of pressure, and it led to a further workup.
Okay.
And an MRI revealed the tumor. So don't ignore it for sure.
Kelsey, I see you from the Abingdon office. Thank you so much for being in here tonight. Shout out to Performance Medicine of Abingdon. Let's get to Leanne here. Then I'll get to Foxy Moxie. Anywhere else to get high-dose vitamin C to have on hand other than Village Pharmacy? I'll call on people in the comments as well if you guys know of a place. I'm assuming it's Village in Knoxville. Is that Knoxville?
I think it is.
I think it is.
Are you talking about intravenous? I mean, you can get vitamin C orally anywhere. You must be talking about high dose vitamin C intravenously, which we have in all our offices. And people that do a lot of infusions will have it.
Let me know in the comments, Leanne, if I need more context for that. I'm gonna put this up from Danny because this is a great comment. If I can, there we go. Vitamin C, ascorbic acid, food grade, 1/4 teaspoon dissolved in warm beverage. I take this vitamin C with 20 drops of methylene blue in a 1/4 cup of warm water 6 days a week. That's incredible. Mm-hmm. I love that.
That's a good little concoction.
It seems like Leanne's talking about the vitamin D supplement. So high dose vitamin D supplement.
Vitamin D,
yeah,
not C. D.
Talking vitamin D, I believe.
Oh, okay. You can get vitamin D anywhere and take a bunch of it orally. The 5,000 units. Just if you want to take 50, you just take 10 of them at a time.
Okay. Okay.
But we do have vitamin D shots in all our offices as well.
So
intramuscular shots.
Leanne, you're talking about the 50,000 units of vitamin D that we're talking about. Okay.
Yeah. You can get the shot, which is one shot for 50,000, or you can take it orally.
And life extension vitamin D is 5,000 IUs, a capsule or a pill, and you take 10 of those. Like Doc said, thank you for that clarification there. Let's see here where we are at. I know I saw Foxy Moxie. Thank you, Foxy Moxie. I have a question for a friend of mine, has ovarian cancer stage 2, 4 rounds of chemo, needs more, but she's anemic, so they stopped. Any suggestions? She had many things done, not helping. Any thoughts around this? We'll be thinking about your friend Foxy Moxie.
Yeah, that's the thing about chemo is it can be helpful, but it can also play havoc with your white and your red blood cells, make you anemic, and also can get your white cell count way down, so you're susceptible to a lot of infections. So, yeah, I mean, always, in addition to what your oncologist has planned, and again, there's ways to get your red blood cell count up higher quickly.
Yeah.
By Procrit and some things that some of the Tour de France bicycle riders would dope with. So there are medicines to get that up pretty quickly. But the other thing too, when somebody has cancer like that, in addition to the oncologist treatment, I always add fenbendazole. That's not going to bring you out of anemia, but it's not going to cause it. So think about looking up fenbendazole and ivermectin and some of the other adjunctive treatments for cancer.
Foxy Moxie, I hope that helps. Thank you for asking that question on behalf of your friend. I hope that helps a little bit. Let's get to Jerry from the UK. What's your thoughts on serrapeptase and nattokinase for cancer, and how much milligrams to take that would be beneficial? What's your thoughts on this?
I can't recall the milligrams. And again, I use those more for, I use the nattokinase for people, for a kind of a natural blood thinner. We used it a lot during COVID. It really works, especially if you can't take aspirin. But there's a lot of evidence that both those together may be anti-cancer. I use serrapeptase for people that have a lot of connective tissue disease, scar tissue, and things like that. But there's some evidence that they both have anti-cancer effects. The dose, I'd have to look those up because I'm not sure. But it's a great question, and there is a lot of anecdotal thoughts that it probably helps cancer. But again, I don't know the particular doses, and there's a lot of good things out of both those herbs. They're pretty cool.
Jerry, thank you for that question. Great question around nattokinase and serrapeptase. And we've done dive into diet episodes and explain this episodes, I believe, on both of those.
They could probably,
if it goes a bit deeper. Yeah.
Tell you the doses because I can't recall off the top of my head.
If you look up serrapeptase, Robin Riddle, or serrapeptase performance medicine on YouTube, that video should show up. I see you, Ruel. Thank you so much for that. Let's see, from Kay on Facebook, I've seen the clip on silent reflux. Does Dr. Rogers treat this condition?
Yeah, of course. Yeah. Silent reflux is still caused by acid, most people think. And again, there's a simple test to see if you have too much acid or too little acid in your stomach. If you don't want to go again, try to find out why it's bothering. Again, silent reflux just means you have acid coming up in your esophagus, but it doesn't cause heartburn. It causes hoarseness or voice box disturbances. So somebody that's always clearing their throat or they're hoarse all the time, they probably have silent reflux. You still treat it with H2 blockers and sometimes PPIs. Again, I don't like to use PPIs for long term, but certainly something like an H2 blocker like Pepcid AC is a mainstay. And then looking at your diet and try to figure out those things that may trigger that reflux. And if it's really bad, you need a scope, look down in there just to make sure you don't have a Barrett's esophagus or some damage to your vocal cords. But yeah, we definitely will look at that and treat that.
Thank you, Kay, for that question. Let's get to Foxy Moxie. What do we need to spell? Let me know what we need to spell there. I missed that as we were talking about it. Let's get to, I like this from Joseph. Started taking oil of oregano at first sign of feeling bad. Has also helped with other meds mentioned. That's cool.
Yeah, that's a great
idea.
Great thought. Yeah.
Let's see here. Holly on Facebook, is Tutka something good to take for a fatty liver? If not, what's best?
I wouldn't say it's the best thing for fatty liver. I use TUTCA really more for cancer, and certainly if it's spread to your liver, I add it. It's a bile acid salt is what it is, and it's certainly one of the adjunctive treatments for cancer. I haven't researched it much, used it much for fatty liver. I'll tell you the best thing I think for fatty liver is the GLP-1 GIPs. It will reverse fatty liver. We're talking Ozempic, Zepbound, that type of medications. I like NAC. I like milk thistle. I like dandelion root, better diet, that type of thing. But great question. Great question.
Holly, thank you for that. I'm going to put this up from Marie. Thank you so much. A new patient here for about a month. Brooke and Pratik are wonderful. They are the best. I feel better than I have in years, still work in progress. Thank you so much for all you guys. Marie, thank you so much. Those are such kind words, and I appreciate you being here tonight and being a part of the live Q&A show. All right, let's see where we are at. If I can, I see Robin's in the building. Robin, what's going on? So great to see you. I see Tracy's in here from the Abingdon office. Tracy, so good to see you. Thank you for being here. If I can see, there we go. Tom's asking around a cortisol test. Amber is ordering a cortisol test for me. Any tips or tricks? Why don't you explain what the cortisol test is? I'm assuming it's
well, you can get a blood, you can get a blood cortisol that comes in the Cleveland as part of it, but the best way to check cortisol is through 4-point salivary testing. And because cortisol changes during the day, it's supposed to be high in the morning, low at night. So there's a curve you need to follow. And that's why if you just measure it once, you're really not sure what it's doing the rest of the time. So unless it's really high or really low, the 4-point salivary testing is the way to go. So just don't, whenever you do a salivary test for anything, including hormones or, just don't eat right around when you do it. And certainly first thing in the morning, don't eat. You're probably fasting a little bit in the morning anyway. Then do it at usually 8, 12, 5, and 10. And you spit in this little tube and send it off, and it comes back. Don't chew gum. Don't eat anything spicy, fatty, greasy right around when you're doing the spit test. And the instructions will be on there, but it's a great way to see if your adrenals are kind of overcooked. So great question.
That's a great question, Tom. Thank you so much for letting us talk through that. I guess it's the home test, the cortisol curve. Thank you for that. I'm going to put, if I can find it, where was I? Now I lost my place. Thank you, Tom, for that question. I'm going to move here real quick to Instagram. Chris is asking, labs done at JC office, which are low. A previous provider advised a Dutch test before starting HRT. Thoughts on that? And I believe a female hormone panel.
Yeah. A Dutch test is a urine metabolite test. It's a really complex test. We order some of them. I think we went over one last week, but it's kind of one of those things that can be useful if you have a strong family history of breast cancer, or you're really worried about taking estrogen, what pathway that your estrone, the worst kind of estrogen, is metabolized down. You got the 2, the 4, and the 16 pathway. So sometimes it's useful for certain people that have had very strong family histories, but no BRCA gene of breast cancer. But it also has a lot of other stuff like the cortisol's on there, melatonin, AM and PM are on there. You have a lot of your neurotransmitters are on there. It's pretty hard to interpret for the average person, but sometimes you do get pretty good information from it. There's no doubt that the urine metabolite test has its place. I used to do quite a bit of them, and then I started asking myself, really, what is this helping me? So it's, I try to use more common sense than that. But sometimes if you want to do a deep dive, and, we have these patients who really want to do a deep dive on it, and certainly that's one way to check hormone values, especially if you're already on them and you want to follow the pathways that estrogen is going down. You could certainly do that. So you might add DIM or endocarbonyl 3.
So are you saying if they were to get a Dutch test, it would be after starting HRT?
Either way.
Oh, either way.
The ones I've seen usually have been on them.
Okay.
Again, Robin's pretty good at this as well. Probably better than me. Yeah. But I'd like to. We talk about it sometimes. How it's almost we're hesitant to order it because it's expensive. Insurance doesn't cover it, and if it's a real complex patient and you're worried about them for some reason, sometimes it's not a bad idea. But they can get overly complex and can be confusing. Robin may want to throw her 2 cents worth in here about the Dutch test. We do them when we have the kids, but gosh, I mean, some people take it so far as to check urine metabolites every day for 30 days during a woman's cycle to look at the variances and what's happening with it. We don't do that, but we will do a Dutch test if you just want one.
Chris, let me know in the comments if that helps. That's a great question. We don't talk enough about the Dutch test because it is something that comes up quite a bit with questions like this. So thank you so much for that question. I'm going to go to Ruel real quick, and I'll get to Big Popular 7 here in a second. Ruel is asking, I am trying to deal with afternoon fatigue without caffeine. I take methylene blue, which noticeably makes me feel better quickly, but increases my blood pressure. I'm going to ask my doc about modafinil next week after seeing your posting, and everyone is advertising for NAD+. Thoughts on combining these? What is a good dose to ask for on the modafinil? That's a great question, Ruel.
Mm-hmm. Yeah. A lot of people get afternoon fatigue, whether it's hypoglycemia. One thing I'd probably do is wear a continuous glucose monitor and see if you're getting hypoglycemic in the afternoons. One thing I do this has really helped my energy levels in the afternoon, is I take a walk, a 20 to 30 minute walk right after I eat my lunch. Every day I do that. I like methylene blue. I haven't seen it increase too many people's blood pressure. I've had a couple people tell me they thought it did. It's interesting. It could on you. Everybody's different. Usually that's not the case, but modafinil, it's an interesting subject. I started 2 people on it today because they had seen the podcast as well. It's kind of like drinking a pot of coffee without any of the side effects. So it just makes you more alert. It's really indicated for shift worker syndrome and narcolepsy. So it's a really interesting drug, and now it's affordable through GoodRx. It used to be so expensive, nobody could afford it. That's the drug that they wrote the movie Limitless about.
Is that really what Limitless is about?
Well, that's the drug they based it on, the smart pill.
That's cool. Yeah.
I've taken it before, studying for boards. And I think it does help you focus. Sometimes I even use it in ADHD when they don't want to take Adderall, or, I don't think they may need Adderall, something that potent. But the dose is, 100 milligram to 200 milligrams is probably the average dose. Some people I have on 300. So it's 100 is a good place to start. If that doesn't do it, 200. The ones I wrote for today, I just wrote the 200 so they can half them and sit for a week and see how that does. And if it's not entirely effective, then I'll go to have them take the whole one at 200 milligram. But I do have a few people on 300, usually bigger guys. But as far as NAD+, NAD+ is kind of the new buzzword. It is good. I would not advise getting it IV. It's just kind of dangerous. You ought to hear Dr. Attia talking about IV NAD+. Really, it's kind of the hype right now. We've even tried giving it in sub-Q shots with 50-50 results. But I prefer, personally, I take the precursors to it. Nicotinamide riboside is my favorite, or NMR. Those two, you can actually take a blend of them to kind of raise your NAD plus. That's more the preferred route of these longevity docs like Dr. Attia. I would avoid it IV. It could cause you to feel really bad. Then you have to drip it so slow, it's going to take you at least 4 hours to get an IV of this stuff. And I just wouldn't do it personally. I know there's a lot of IV clinics around, but they'll charge you arm and a leg for this, and I just don't see it. I don't think it's a great thing to do. But I'm not against taking NAD plus. There are pills of it, but it's very hard to absorb. That's why I prefer the precursors. But that's a great question.
Ruel, thank you so much for that question. Ruel saying he can't confirm methylene blue with vitamin C does work to stave off when you feel icky. Thank you for that. Let's get to D. Lynn. Thank you, D. Lynn. She's got the stress relief. Not taking it yet. What is the best time to take the stress relief, and does it make you drowsy?
It doesn't usually make you drowsy, but the first dose, or if you take it at night, because it relaxes you. But interestingly enough, most people take it during the day because
really?
The days are stressful.
Yeah.
It just kind of blunts that cortisol effect. I like it because it's got all three of them: L-theanine, saffron, and ashwagandha. Three of my favorite herbs to kind of relax you, but it shouldn't make you real drowsy. I'd be surprised if it does.
So you can take it to start your day, essentially.
Okay.
Especially
if you have a real stressful job.
Need to be with food?
It doesn't matter.
Okay.
I don't necessarily think so.
D. Lynn, I hope that helps. Thank you so much. Let us know how that is helping.
Try it. I think you'll like it.
Yeah. Let's get to Wayne here talking about peptides. Any peptides or supplements you would recommend for cognitive benefits like focus, concentration, or memory? Modafinil would be one.
Of course.
Would be.
Well, that's not a supplement or a
supplement.
peptide, but it's a prescription medicine, synthetic. But of course, I like methylene blue. That's my favorite one. Another one, of course, is a nicotine patch. I put somebody today on that. Who has Parkinson's and is getting some cognitive impairment. Life Extension makes a pretty good vitamin called Cognitex that has acetylcholine in it. And another one that I like is Bacopa. Bacopa is a really good one. I like BPC 157 too.
For this,
I think that's a peptide. I think does help me. I certainly take it. But those would be the main ones. Trying to think of any more I would use. I'll tell you the best supplement for cognition, concentration, memory is exercise.
Agreed. Wayne, thank you so much for that question. I hope that helps a little bit.
And creatine.
Yeah.
You have to use a little higher dose.
For the mental aspect?
For brain protection, longevity. Then I really think that these GLP-1s are going to work for that too.
Speaking of GLP-1s, I'm going to put this up from Marie here. Does Manjaro help with fatty liver as well?
Yeah, sure does.
Okay.
Manjaro is a combination of GLP-1 and GIP. To me, it's a better drug than Ozempic. Beats it in almost every trial with less side effects. And there's one coming out that's going to be called Triple G. It's not FDA approved yet, called retatrutide, and that's going to be the daddy, I think, as far as that goes.
Let's get to Diane here. Arthritic knees and want to start meloxicam at 71 years old. Is it okay to mix with 1 5 milligram Eliquis?
There could be a little problem with that. because that's a non-steroidal, and you really got to be really cautious when you're on a blood thinner taking that. Now, personally, I just tore some cartilage in my knee playing pickleball, and I take meloxicam. I'm 70, so certainly it's not too late to take meloxicam, assuming you have good renal function. But I don't take a blood thinner like Eliquis. So you got to be really cautious with that. I probably would not recommend it.
All right, I'm going to get, thank you, Diane. I'm going to get, I think maybe we have Jordan's on YouTube, and then we've got Big Papa 7, maybe the same person, but they're around L-carnitine. So I'm going to put this up from Jordan and also read from here. L-carnitine for fat loss, what brand do you trust? Your thoughts on it, where to get dosage. What's your thoughts on this?
Well, it's not, you're not going to lose a ton of weight with L-carnitine. Where it's effective is when it's combined with tirzepatide or semaglutide, the GLP-1, GIPs, and when you get the compounded form, that's what it's going to be mixed with a lot of the times. Certainly the ones we order are mixed with L-carnitine. So in combination, I think it probably helps. With in singular form, I just haven't seen it work that well.
Okay,
personally.
Big Papa 7, does that help? Let me know if you need more context around that. I want to get to Robin here. Thank you, Robin, for the question. What would indicate of a mid-70-year-old male to have low red blood cell count and low hemoglobin level on a regular CBC? Thanks for putting out all the great info. Thank you so much for watching. What's your thoughts?
Yeah, so he's anemic. And first of all, you need to find out why he's anemic. I have some people that have a barely low level all the time since childhood. Their reticulocytes just didn't pump up enough iron. But you got to make sure he's not losing blood somewhere. And he has a polyp or colon cancer or some other type of cancer that may be causing it. So always compare what he's usually runs to what he's running now. If it's lower, it needs to be looked into. And again, you need to get a CBC with differential, and you need a ferritin, you need a total iron binding capacity and iron level. So you got to dig a little deeper on that one. That's could indicate just anemia from chronic disease. It could have some kind of microscopic bleeding somewhere that you don't know about. So it certainly warrants a workup.
Robin, thank you so much for that question. I hope that helps a little bit.
It also could be a malnutrition type problem, an absorption problem from the stomach. Needs B12 and folate levels done as well. And to see if that anemia is microscopic or macroscopic, or has a normal differential. So just a better workup on that. Don't ignore it, especially if he's tired.
Thank you, Chris. I see you, Chris. Thank you so much. Let's get to Sandy. Are there any extra benefits to using the estrogen patch in addition to my compounded cream? Or is it just using the compounded cream enough as far as getting all the benefits of estrogen replacement?
Yeah, if you're on a patch, the cream's going to have the estrogen in it, the biased, as well as probably progesterone, testosterone, DHEA. So the compounded cream is what you need, unless you just want to spend more money, or for some reason you like that patch. I have had a few people that were so used to just doing the estradiol patch that they just added oral progesterone at night, which is really the only oral form of hormone besides DHEA that I use orally. I don't like to use estrogens orally or testosterone orally. So you can certainly do that, but you don't need a compounded cream with estrogen in it in addition to your estrogen patch. So I just usually make it simple, put it all in the compounded cream.
Sandy, great question. Thank you so much for that. Let's get to my brother Mark here. For mitochondrial restoration and fatigue resistance in the morning, methylene blue 20 drops, leucine 3 grams, valine 1.5 grams, midday glutamine 5 grams, arginine 3 grams, thoughts or suggestions? And I hope I pronounced all those right.
Yeah, you're looking at a lot of essential amino acids. It's just really good. And that pathway, leucine valine go down is pretty interesting. But yeah, I mean, that's a good, great thing. I always like CoQ10. I like PQQ. I like taurine. All those things kind of help for energy levels. And it's all about the mitochondria, like Mark says. Your mitochondria are aging, and they're not pumping out as much ATP as they used to. So yeah, that's a really good regimen.
Thank you, Mark, for that great regimen there. And I hope I pronounced those right. Let's get to H. Buckland here. Do you test for MYH7 gene mutation? My mom has a mutation and her doctor recommended her daughters get tested. The mutation has caused myopathy in her legs and hypertrophic cardiomyopathy. MYH7.
Yeah, that's not one that we check in our office, but that's one that you probably need to get through a specialist or do genetic testing at one of the universities, and they can check that gene. That's not a common one, so we don't have that available in our office.
Thank you, H. Buckland, for that. I hope that helps a little bit. Let's get to Roel's comment here. Doctor, I heard the latest GLP-1 is called bioglutide and is supposed to be administered orally. I heard great news about it. Have you heard of bioglutide?
Yeah, that's the one they're trying to get out
G?
in oral. No, it's not triple G. That's retrotrutide.
Okay.
But yeah, they're trying to. I think Lilly is coming out with hopefully that, and we'll see. They're clamoring for an oral GLP-1.
Yeah. Cofix, Foxy Moxie, if you're still with me. Sorry, I missed this. Cofix, COFIX. Thank you for that. Let's see if I'm missing anybody's. Barbara, hello, Barbara. Can you tell recommended treatment for hypophosphatemia?
That's good. Phosphate, there's phosphate supplements. Sometimes you see that in people with renal disease, but yeah, you can get phosphate tablets. But make sure you monitor it and make sure it corrects it. Make sure it's being absorbed. That's not one we see a lot of, probably because we don't check for it that much.
You can tell, guys, he's grading my pronunciation. That's
perfect.
After these shows, he's like, you mispronounce this.
Yeah, you're doing well.
Let's get to Cindy. Thank you, Cindy. How much berberine is too much? I usually take 2 a day, but am currently on Candibactin BR for stomach issues, and berberine is in it. 400 milligrams. Should I cut back? This is something to look out for.
Number one, make sure it's dihydroberberine. I think that works better. The berberine hydrochloride is not as potent, so you probably take more of that. But it'd be very hard to overdose on it. When you're taking too much of it's when it starts upsetting your stomach, is what I would. So you don't necessarily need to cut back on it. I have a lot of people that take 200 milligram 3 times a day, commonly.
Cindy, thank you for that. Carter, thank you for the encouragement. Carter's like, you're doing great. Thank you. Okay, I think we are caught up on the questions. If I miss somebody, put it at the end. We're going to call it a show here in the next couple of minutes. I'm seeing a few 10s already. Thank you so much. Let us know in the comments how we did. And if I missed your question, quickly put it at the end there before we wrap up. And real quick, if Lisa's still with us, I want to lift Lisa up tonight. We're thinking about you. We're praying for you. And please keep us posted with how you're doing. Lisa
she's out of the ICU.
She's out of the ICU, and I believe she's on her path to recovery.
Wonderful.
So thank you guys for praying and lifting her up. And Lisa, we're right here with you. Thank you so much for being here. Okay. Barbara's saying West Foss 250 milligrams with the.
Yeah,
okay.
Yeah, that's a good one.
Teresa is asking, what do you recommend to take for high cholesterol?
Nothing. I don't think cholesterol causes heart disease in the first place. But if you have familial type 2 hypercholesterolemia, with risk factors, I will use some stuff, but you know, first of all, get an advanced lipid panel to make sure. I saw somebody today with a cholesterol of 270, but their HDL was 93, the good cholesterol. Their LDL was below 100. Triglycerides were good and low. The LDL was not oxidized. It was a type A LDL pattern, so metabolized efficiently through the liver. So didn't need anything for it. So, you know, I occasionally will use a statin if somebody's really has a lot of risk factors or pre-existing disease. But you know, you gotta think long and hard with me about me putting you on a statin. Repatha is a new one. It's very expensive. You know, it's an infusion. I think I don't prescribe it. You have to go to a lipidologist, but it's not a statin, and will really lower cholesterol pretty well. They recommend it in conjunction with a statin for some reason, but you know, I don't like to see cholesterol's too low. So certainly I use a lot more niacin than I do statins. You know, vitamin B3, you have to really go slow, because somebody goes and gets an over-the-counter 500 milligram niacin, flushes, and they'll go to ER thinking they're having anaphylaxis or not. So I'll work it up, start at 100, take it at night with a baby aspirin and maybe a little applesauce, and work your way up every 4 nights by 100 till you get to 500, maybe 1,000. And sometimes I'll use other fiber products like fenofibrate, you know, Questran, or some of those that affect the absorption. There's two types of people in regard to hypercholesterolemia: those that their liver pumps it out too much, and those that just over absorb it from their colon. And you have to do some advanced kind of genetic testing. We used to do some of that on the old Boston panel, would show you those numbers, but you certainly could get them if you needed it. But so yeah, so I'm not big on pushing high doses of statins. Plus, did you hear in the news that I don't know how many doses that they're having a recall of Lipitor, atorvastatin, because of contamination? It's, I mean, I think it's hundreds of thousands of pills that are contaminated. So, of course, that could happen with any drug. But, you know, I'm just cautious when it comes to over treating cholesterol. There's many factors I'll look into before I'll pop you on something like that.
Teresa, thank you for that question. Let's get to Leslie real quick. Anything you would recommend to a 43-year-old woman who just had a hysterectomy, still has one ovary, but didn't know if there's anything you would recommend to take? Leslie, thank you for this question.
What I would say, it's a great question. I would get your labs and see, because usually you'll probably go into a little bit of an earlier menopause than somebody who hadn't had a hysterectomy, because when they go in there and take your one ovary and your uterus out, they're cutting some of the nerve and blood supply overall. So you may go into an early menopause. So certainly look out for symptoms of menopause: hot flashes, night sweats, decreased libido, dryness, stuff like that. But remember what I said about progesterone. It's very important, even though you've had, you know, you don't have to have it according to the gynecologist, but those that are advanced through hormone education know that you still need progesterone. So some natural progesterone might be something that would help you, especially because you don't know whether you're estrogen dominant, if you still have any progesterone floating around that you need, also testosterone. So I recommend that you watch out for these things and go ahead and get a baseline, a female hormone panel, and see where you are. I think any woman in mid 40s ought to have a basic female hormone panel. And then yearly.
Can you say what's on the female hormone panel?
Yeah, estradiol, progesterone, testosterone, and sometimes a DHEAS.
Leslie, thank you so much for that. Thank you for that question. Jerry is asking, what supplements can you take together to work in synergy? I know this is a little general. Jerry, is there any kind of general?
D with K.
Yeah.
That'd be the one I would.
That's actually a great answer. So D with K. So as far as supplements that work well together, work in synergy, vitamin D with K. I know you recommend that for anybody over 40. Yeah. Jerry, I hope that helps a little bit. And let me know in the comments if we need more context, and I'll make sure we get to that first thing next week. Guys, thank you. I think we're at around the time that we end the show. I just want to give a huge shout out to everybody who was with us all evening live. Thank you all for helping us do this show, for contributing through these amazing questions. We got dogs here. I'm going to turn the podcaster off. As you guys know, we record the podcast so you can re-listen to this next week. Comes out Tuesday on Performance Medicine TV on Spotify and Apple and all those places if you want to re-listen. Or you can just scroll back and get any of those answers you want. There's Ike right there. We got Izzy somewhere. Izzy's down here.
You know, Izzy.
She's camera shy, apparently.
She's also a little heavier.
Thank you, guys. Yeah, Mark, that's right. Can you play Subterranean Homesick Blues?
I'm working on a few classics.
Guys, we love you. Thank you so much for being with us every single Tuesday. We do this every Tuesday, 7 to 8. Ike wants to get up. You want to get up? That's Izzy. We do this 7 to 8 every single week. Y'all make this show great. Thank you for continuing to come and ask amazing, thoughtful questions. We'll continue to be here and answer as well as we can. I'm going to continue to pronounce these words as best I can. We love you. All right, we're signing off. Thank you, Connie Lynn. Thank you, Carter. Thank you, Jerry. Let us know in the comments how we did. Give us a 1 to 10. I want to see a 3. You know, if we did a 3, I need to know. Thank you, brother Jake. Thank you, brother. We're going to get you. Jake's on the podcast here soon. We're talking about eggs. All right, Elena, thank you. Thank you, guys. See you on Instagram. All right, where's my outro, Brad? Where is my outro? Usually my timing's better. There we go.
All right, here we go. Hey, it's Jake, Brookhaven Farms. We're here with one of our little heifer calves, and she's just hanging out with me and Dr. Rogers. I think it's going to be Dr. Rogers' new assistant. No, she's a good calf, and we're just here and want to show you guys that, you know, we're a real farm, real people, real animals, and we provide real food.
Yes.
There you go, Jake.
Shout out to Jake. I love that. All right, now we're going to get to the outro. Jake, I love you. Brookhaven Farms. I love that.
All grass fed. No
That was
hormones,
amazing.
no
Thank you.
pesticides, Nothing.
Thank you, team. All right. See you guys. We'll see y'all next week.
Don't go.